Dr. Samantha Green wins Toronto Centre NDP nomination. Exclusive RPTV interview reveals her vision for a community. On Saturday, May 4th, the Toronto Centre NDP held its federal nomination meeting, a pivotal event to determine the party's candidate for the upcoming federal election. Among the contenders were two candidates, Brian Chang and Dr. Samantha Green. The event held in the gymnasium at Winchester Junior and Senior Public School. Dr. Samantha Green emerged victorious, securing the nomination to represent the NDP in the Toronto Centre riding. Dr. Green's nomination marks a significant moment in local politics as she commits to championing the needs of the community in Ottawa. With a strong background in advocacy and community engagement, Dr. Green brings a wealth of experience and a fresh perspective to the forefront of federal politics. RPTV had the privilege of sitting down with Dr. Samantha Green, the newly nominated Toronto Centre federal NDP candidate. We're eager to delve into her motivations for nominations and her vision for addressing pressing issues in our community. And now let's go into Dr. Samantha Green's interview.
Thank you so much for having me. I'm a family doctor right there. My office, you can actually see it at the Sumac Creek Health Center here in Regent Park. And I'm a mother of three very young children. And, when I was asked to consider running in the nomination, I thought, this is really something I need to do. I need to step up because there are so many intertwined crises that we are facing as a community, as a country, poverty, housing crisis, and the climate crisis. And I want to see, I want to tackle these issues, and I want to see the NDP really proposing bold solutions. And I think I can help do that. Yeah, I mean, it's clear we need to invest money in the housing crisis. We need to build more social housing, cooperative housing, nonprofit housing, and that's going to take federal money. We need to reinvest money in Toronto community housing because we all know that the state of TCH is pretty terrible. The state of some of the units and the buildings, and just the way that people are treated, and the waiting list is just terrible. So we need to reinvest in social housing. We also need rent control. It's really, awful. I've heard many stories of patients of mine. For example, I have a patient who works full-time in childcare and could no longer afford renting her bachelor apartment because the rent was jacked up several $100s all at once. And she ended up in a women's shelter because, even though she's working full-time in childcare, she cannot afford to live in downtown Toronto. And that just needs to stop. We need rent control. We need investment in social, cooperative, nonprofit housing. We also need to, build more units for families because we do need more supply in downtown Toronto. But that can't just be, condos that only very wealthy people can afford. We really do need to invest in social housing. Yeah, I mean, we also are facing a primary care crisis, and I know this well as a family doctor. So what I think we need is, again, like an investment in really primary and preventative care nationwide, and that includes allied healthcare services. So, I mean, there really ought to be universal access to psychotherapy, mental health services, because that is part of healthcare. Healthcare is not just doctors and hospitals, which is currently what is funded under Medicare. I'd also say that we need to tackle the toxic drug crisis. I've had far too many of my patients die because of the toxic drug supply. So we need a safe drug supply, and we need wraparound comprehensive supports for people suffering from substance use disorders. And that also means we need to tackle the housing crisis, because one of my first prescriptions for someone suffering from substance use disorder is housing. Those are some of the things I would propose doing to tackle those issues. Yeah, I mean, we need, again, to invest in social housing, cooperative housing, nonprofit housing, and at the same time, we need to invest in green space, and that will help us, tackle community isolation, social isolation. It'll also help with the climate crisis because we know that extreme heat is increasing in places like downtown Toronto, and the more green space there is, the lower the temperature during those very hot days. A place that doesn't have enough tree cover is 12 degrees or 15 degrees hotter than a place that has adequate green space. So we need to build in that green space in addition to adequate community housing. We also need, community facilities like the Aquatic Center that's right over there, and the Regent Park Community Center. We need to continue to invest in those kinds of facilities that help bring people together and build community. Yeah, the climate crisis is the biggest health threat we face, and we know that kids born today will have their lives shaped and constrained by the climate crisis, and it's really one of the main reasons that I decided to run in this nomination race and become the NDP candidate for Toronto Centre. We need bold solutions, and we need them now, and that means we need to stop burning fossil fuels immediately. We need to stop investing in fossil fuel extraction, and we need to really invest public money in the energy transition. So we can't leave anyone behind in this energy transition. We need to invest in green jobs, and green infrastructure. And so I would propose, creating public institutions that would employ people in, for example, creating heat pumps, which are a green replacement for gas-powered furnaces and air conditioners. We need to create public institutions to build rapid transit so that we're less reliant on cars, especially in the GTA, where we have so many highways and so much reliance on cars. So I think tackling the climate crisis is one of my main concerns. I also think we need to invest money in adaptation because the climate crisis is here, unfortunately, and the world is warming, and we need to be better prepared. So that means investing in green space. That also means just being better prepared, for wildfire smoke, for extreme heat on a community level. We need to have public cooling spaces that are accessible, that are welcoming, that people want to go to, and not just, right. Currently, the City of Toronto has a handful of cooling centers that they open on those extremely hot days, but they're not that welcoming for people who may be older and socially isolated, may be suffering from mental illness. Yeah, I have 3 young kids. My son goes to Winchester, and I have 2 young daughters who are at Cole Street Daycare. I'm terrified about their future and the looming climate crisis. It also just makes it really real. I think all the difficulties that people in Toronto Centre are facing. I see it with what my kids. I see it through the lens of my kids. I'll just tell a story. I took my kids to the playground at Allen Gardens a couple of months ago, and my 5-year-old son Jack, he turned to me and he said, "Why are all those people living in tents?" And I couldn't give him a good answer. I couldn't give him an answer that was satisfying because why do we allow this to happen? Why do we elect governments that tolerate this? Why don't we have adequate housing for people, housing that meets their needs? So yeah, having kids and seeing the world through their eyes is really one of the reasons that I'm doing this, and hopefully we can kind of fix some of those issues moving forward. I mean, the number one thing is we need people need adequate income. Food insecurity is really a measure of poverty, and so one of the proposals that the NDP has put forward is a basic minimum income for people, and I would support that. I also think we need adequate supports for people living with disabilities, which currently, ODSP is not a living support. Like, people can't really live on the amounts that they're receiving through the Ontario Disability Support Program. So people with disabilities need adequate support, and there really just needs to be basic income for people. I mean, I think also part of the issue is like corporate profits and the financialization of food, of groceries. I mean, how is it that people don't, like, there are children who don't have access to food in our wealthy country, and that's related to, corporate profits. And so I think there should be a way to tackle greed, tackle corporate profits, and make sure that people have enough money to live on. Yeah, I mean, I'd love to hear from everyone who's watching this, listening to this. I'm by no means an expert on the issues that we are all facing, and I'd love to hear ideas from Toronto Centre residents on what needs to happen. So just email me and I'd be happy to meet. I'm happy to meet with groups, but also with individuals. And I think, should I be elected, that would be a core part of what I do. I really actually, thinking about my work as a doctor, there are some similarities with the work of a member of parliament. It involves a lot of listening, a lot of collective problem solving, coming to a diagnosis together, and coming to a treatment plan together. And so hopefully some of my skills as a family doctor can be translated should I become a member of parliament. Yeah, I mean, I think I've spoken about most of the issues that I would hope to centre as a member of parliament. I would just add that I think a lot of people in Toronto Centre are also concerned about the horrific and ongoing genocide in Gaza, and I would hope to, in federal politics, international issues are a part of what we deal with, and I would hope to call on the Canadian government to stop funding the genocide, stop sending military aid to Israel. We really need to be calling for an end to the apartheid Israeli government, and we need to be supporting what Palestinians are calling for, which is peace and also justice, and an end to apartheid. So that would be another aspect of something that I would bring as a member of parliament.
Thank you so much for watching. Don't forget to like, comment, share, and subscribe to our YouTube channel. Also follow us on social media, and for more information, check out our website.